Okay, we're going to talk a little bit about Sustainable Development Goals. These are 17 goals set by the World Health Organization to promote health. Even though some of them do not seem to be related to health, they include things like eliminating poverty, education, climate change, infrastructure, safety and security from, violent conflict, things like that. You'll actually explore the 17 SDGs and you'll post about the one you think you would like to prioritize. So we'll move forward with the social determinants of health. And this should be really familiar for you guys. I'm sure you've heard all about social determinants from the very beginning of this program. These are non-medical factors that impact health, and these can be things like the built environment, where people grow, work, live, and age. And they include things like economic stability, policy, culture, racism, gender roles. All of these things have an impact on global health. Levels of prevention, this is another concept you should be familiar with. Okay, so in community health, you're learning primary, secondary, tertiary. In this course, we will talk about primordial prevention. What is primordial prevention? That might be a new concept for you. It refers to changing social and economic policies to build communities, states, countries that address the social determinants of health. Those things that impact health but aren't health necessarily. Okay, the Mercy Experience in Global Health. This is the Mercy team. I think they went to Haiti back when we were doing that. There's also the Mercy ships. But we can weave a lot of the mission and values of Gwinnett Mercy University and the critical concerns of the Sisters of Mercy into this content because it aligns very closely. Thank you for joining me on this journey to learn about global health. Together we can make a difference. I'm going to leave you with one little story about Rwanda. Occasionally I will get comments from people that this course is a little bit depressing because it points out all of the disparities and negative things. I'm going to talk to you about Rwanda. So back in the 90s, Rwanda was in a violent civil war between two of its ethnic groups. And it was devastating. It decimated the Tutsi population. When they came out of that civil war, when it was over, I think the world sort of knew the atrocities that had happened, and they provided aid. And what the Rwandan government decided to do was to prioritize health, education, and infrastructure with that aid. And Rwanda is an interesting country. There's a lot of geographically very remote, mountainous areas, hard to get to things. They built community health centers in every rural community. And the gains that they've made in education and in healthcare are nothing short of miraculous. It can be done. It just takes the best minds working together and the resources distributed amongst people in a way that is equitable. And we will learn how to do that in this course to some extent. Thank you.